Basic life support, or BLS, is a crucial set of emergency care techniques that can mean the difference between life and death in critical situations. It involves a series of simple but effective actions that can be performed by anyone, regardless of their medical training. The primary aim of BLS is to maintain adequate blood circulation and oxygenation in a person who is unresponsive or not breathing. This life-saving skill is essential for first responders, healthcare professionals, and even bystanders who may find themselves in an emergency. One of the most vital components of BLS is recognizing when it is needed. Signs that someone may require BLS include unresponsiveness, lack of breathing, or irregular breathing patterns. If you find someone unconscious or unresponsive, the first step is to ensure your safety and assess the situation. Call emergency services immediately while preparing to administer BLS. Remember, swift action is essential, as every minute counts in the event of a cardiac arrest or severe medical emergency. Once you have assessed the situation, the first action is to check for responsiveness. Gently shake the person's shoulders and shout to see if they respond. If there is no response, you must position the person safely on their back and open their airway by using the head tilt, chin lift method. This technique helps to ensure that the airway is clear and that the person can receive oxygen if they begin to breathe again. If you do not hear any breathing or only gasping sounds, it is time to begin chest compressions. Chest compressions are a critical part of BLS, and they require correct technique for maximum effectiveness. Place the heel of one hand on the center of the person's chest, between the nipples, and your other hand on top of the first hand. With straight arms, compress down approximately 2 inches deep at a rate of 100 to 120 compressions per minute. It's important to allow the chest to fully recoil between compressions to maximize blood flow. If you feel trained, you can also provide rescue breaths after every 30 compressions, using the mouth-to-mouth technique, or, if available, a barrier device. Finally, it is important to maintain your efforts until professional help arrives or the person begins to show signs of recovery. Continue to administer BLS as needed, alternating chest compressions with rescue breaths if you are trained to do so. Remember to stay calm and focused, and encourage anyone nearby to support you by calling for help or fetching an automated external defibrillator or AED if available. Learning and practicing BLS can empower you to save lives and provide critical assistance during emergencies.